Howdy, everyone. Matt here. I got a question for you. How would you describe what the average physical therapist would do in the average session? I'm not talking about yourself. I'm talking about that average one out there. Do you think that they're going to have somebody come in, do an active warm-up, do some resistance exercises, maybe put their hands on them a little ways, educate them about what's going on, send them on back the door? Or is that average therapist doing an average treatment? Are they just going to have them lay on a hot pack, stretch them just a little bit, do a couple little light things, throw them on some ice and stem? Bye. We'll see you in 2 days. Which one do you think it is? But first and foremost, let me introduce myself. My name is Matt. I am Matt the PT, and I'm coming at you with another video on a topic of something going on in the physical therapy world. Second of all, I'd like to thank you. Thank you for tuning in to the video. Thank you for the likes, the comments, and the subscriptions. Thank you so much. If you like the video, hit the thumbs up and consider subscribing to the channel. And of course, most importantly, let me hear your thoughts, your beliefs, your opinions. Let me know about that. I want to have this discussion and this, what do you feel? I feel like that is very, very important on what we need to do. Now, I've been thinking about this here lately. What is really like the average treatment? What is the average physical therapist doing in the average treatment? Now, the example I talked about, that's an orthopedic session on it. And I'm just going to use that as a reference. That's probably the biggest area of physical therapy. I believe that's the biggest area is like orthopedics. Please don't come at me. Everyone else, we're all important. But I'm using that. That's my reference on it. It's just orthopedic setting. But really, how is that session on it? If somebody had to describe what the average physical therapist does, a physical therapist session is, how would they describe it? And is it really a bad thing? Now, this came about from a couple things. I've mentioned before, there is that study out there that found that 80% of physical therapists, treat an average, so fall right in the middle with 10% being above and 10% being below. And if you look at the study, which I will link on here, it's talking about in spine, treating spine disorders, or spine issues. And really there wasn't a big difference between the two on there. And I was thinking about that, and I listened to somebody talking about like personal finance and, just how to get ahead in your finances. And they made a point about doing average things on it. So, just like paying off of your debts, not getting high rate, interest credit cards, investing in your 401k and just doing those little things, and saying that those big flashy things that you see that we talked about the influencers before, those big flashy things that people say aren't really what are going to get you ahead, because you can lose a lot. Those people show that doing all this stuff, but really if you're doing those boring things that are kind of average, you're going to do pretty well overall. And I started thinking about that to say, is the actually average therapy session really that bad? Is the way that people make it out to be? And I'm going to talk about that. Now, let's talk about how patients may describe the average physical therapy session. And I would say, if we think on an average, because you're going to get the people that love us, you're going to get people that hate us. What am I going to talk about? But what are you going to hear more on average? I think from what I hear most is about people talk about how, therapy was so hard on them. They pushed them. They maybe made them hurt a little bit. Really, how, and if you really get into it, is it all necessarily bad? Now, I would say we have to be careful of taking it really at face value, because as Adrian Lowe says, patients remember two things: the last thing you told them and how you made them feel. So in terms of someone saying, oh, they made me hurt because they were pushing and pulling on my arm or bending my knee right up, really diving into that, and I'll ask somebody, can you talk to me about that a little bit more? And you may find out like it was not really all that often they like pushed their knee or they pushed them into those things. And this person maybe had a surgery, had something going on, but like, we really had to stretch that, really had to work that. And then they may talk about, oh, I maybe do all these exercises and all that. And you can ask, well, why were you having to do them? And they may say, oh, they never told me. But really honestly think of all the therapists that you work with, do they often just give people exercises just willy-nilly going, do this, do this, do this, do this, without an explanation? I don't really hear that often. And I've worked around a lot of therapists that many of them will give an explanation of why they are giving somebody an exercise. I can completely understand why a patient may not remember that, because you got a lot going on. First off, you're hurting. You're not feeling good. How well are you going to intake information when you're hurting? Also, we can also just give people a lot of information at one time. There's so much going on in a therapy session, plus everything going on in their life. And they may not remember those little details on it. And if you sit and you just work through that, you find out it's like, wow, they actually did a pretty good therapy session on it. Now, another one are, I say those people, they're not therapists. They're not physical therapists or physical therapist assistants that are trying, that are like coaches or trainers. And I see them, pull up on these things by saying, oh, your therapist, you need to do this stretch because your therapist has never touched a barbell. They don't know what they're talking about. Or, oh, you're just going to go to therapy. They're just going to grab these little pink weights and these little light bands and they're going to do all this pointless stuff with you. The thing is, they're not getting into the details of the who, what, when, and why, as well of why we're giving people those exercises or doing those things. I actually know a good number of therapists who do utilize barbells and weights in their training. I can also tell you that it's pretty hard, and I know many of y'all may be able to say the same thing, that sometimes it's hard to get a person to start using weights, doing resistive exercises, because there's a lot of barriers to it. I mean, one, it's, the time and the effort to go out to a gym, understanding what to do, getting someone to teach you what to do. This is the mental barriers that people can have. They can just be scared of doing that. And it can take a while to really work somebody through that to where they get comfortable moving. I'm not making excuses. We're all different. We're all different. Now, I will say, when you get into the things that Lou's going to make you use like little pink weights, I think what we need to do is the heaviest weights in your clinic, you need to start painting pink. We need to start painting in those colors. So when somebody, we just use those pink weights, you'll be like, oh, the 100s over there? Yeah, we got people using those. Oh, yeah, those over there? Yeah. So kind of flip the script on it. So I think they're good. But again, I see that in books. People talk about that stuff. Your therapist will find this movement is just pointless. It's like, okay, you're grasping, you're going to create a straw man argument on it, where they're actually, the things that we do, maybe with the light weights or the light bands, is very specific. Somebody comes in after a rotator cuff tear. Yeah, we have to use light weights because we can't stress that tissue on it. Maybe we're introducing someone back into a movement or something. So yeah, we have to use lighter weights and things like that. They don't ever get into the actual details of it. Now, as well, with those exercises and things that people say, look, your therapist will tell you that this is dangerous. Once again, they can be very specific to people. Sometimes as well with doing some kind of specific exercise or something that maybe, those are going to say it's dangerous. There's a learning curve to it. Maybe there's an adaptation that has to go on. The average person can't do that off the bat. They have to adapt and they have to get used to doing it. So we're going to tell the average person, like, no, you don't need to do that unless you get a good amount of training and understand how to work into doing those things. I don't tell people to not do things, but however, I do tell them, like, if you just don't know how to do it, just don't do it on your own. We're going to work on it. I'll use, for example, like kettlebell swings. I give kettlebell swings to a lot of patients. I really like them, and I do them pretty heavy. But if somebody does not know how to do them, I'm not going to give them to them. I was like, yeah, we're going to work on it in person. Then as you get more comfortable with it, we're going to work with you doing it. Because anyone who does kettlebells is going to say, yeah, there's a component with form and doing stuff on that. We just want to be safe with you. Now, this is the funny one. Our other fellow therapist, And they get in, oh my gosh, I see this stuff. People talking about, you're just a mediocre therapist, that, what do they say? Oh, you're just going to be warming up hot packs for people. Or they get into saying like, oh, you need to test this muscle like this or do this exercise, this way. You have to do this way because they're going to teach you this. This is wrong on it. But they're usually trying to sell you something on it. They're just really trying to sell you something on it. And once again, they create a straw man argument on this stuff. Really. I'll say this as well. Is using a hot pack bad? Is it always bad? Really? Give you an example. So where I work, I get a lot of patients that are very high stress, in a very high stress environment. They got a lot going on. Would having them come in to sit on a hot pack for maybe 5-10 minutes help them? Help them calm down, bring them down? Do I want to have them come from, work in a very fast-paced, high-stress environment to another high-stress environment where I'm going to be throwing more information at them that they may not be receptive to? But when that patient could actually benefit, it's like, hey, you know what? I'd like you to just sit over in this chair. I'm going to give you a hot pack. Just hang out for 10 minutes. Don't turn your phone on. Just hang out for a little bit. Is that compassionate care on it? Really? And maybe get a chance to start talking to that person. Maybe can educate them on stuff because, hey, I'm calming down your nervous system, kind of bringing you down. Is that necessarily a bad thing? Are you going to say, oh, it's bad because you're warming up hot packs and you're just throwing hot packs on people? Okay, here's the reason why I'm doing it on them. I can give you a reason why, and it can be beneficial. And maybe I'm spending the time educating and talking with the person while I'm doing that. I wonder if somebody's going to take that clip and just go bonkers with it or whatever. Or the other things, oh my gosh, when people try to like reinvent something to go about like, oh, we're going to do all this stuff and we're going to, does it make any sense? It like never makes sense. I see people doing this stuff and it's like they want to try to sound like they're so advanced, but it's like, good gracious, this stuff doesn't make a bit of sense. And when you start kind of like trying to poke holes in it and like trying to, prod it, what is this? It just falls apart. Really, honestly. But I'm going to say, I don't think it's actually a bad thing being an average therapist. Because if you really look at all the evidence, if you're following the evidence, which is what, on average, you're doing pretty good on it. You're educating people when they come in with them. You're getting patients in. You're educating them. You're not doing just cookie cutter routines going, okay, you're going to do this, you're going to do that. You're just, we're just going to give you the sheet every time that you come in, and that's all you're going to do. Maybe there are some that do that. Maybe sometimes the patient, but you tailor what you're going to do with patients. You're working to the best of your abilities to help people. You're getting people moving. You're getting people active. You're understanding those things. There's going to be variations in your patient population on it. I worked with some very sick people in a county hospital for a period of time. Very sick. Just a lot of social, the social determinants of health. So low socioeconomic status patients. You had to kind of go about it a different way, these people. You had to spend a lot of time educating and talking with them. Just getting them to go walk was a big deal on it. So yeah, could I have this person, we're going to start doing some deadlifts and barbell back squats and, all this crazy stuff. Hey, a sit to stand is a lot for them. We're starting with it. We're going to talk with you. I love working with people like that. Just think about it. And I make it tailored to every single one of them. And I'm trying to work as best I can with every one of them. So one, that they do the stuff. Two, that they come back. Really. And honestly, think about what is average. In school, C is an average. C's get degrees. People say 75%. Do you think it's bad if you got 75% of your patients better? Do you think that's a bad thing? Really looking at it. Now, I know it's probably, not like those one-off stuff like the goofy fictional pattern stuff that fixes 100%. Like they claim they fix 100%. I mean, we're not all as good as them. But 75% of your patients that get better, That's pretty good, isn't it? Now, really think about all the patients. Now, I'm just talking about everyone that comes in your door. Can you actually help every one of them? And I think it's a big deal when we see as a therapist that we can't help everybody. I recognize that. When people try to knock on me for the McKinsey stuff, you can't help everybody. I know that. Robin McKinsey said that. He goes, I can help 70% of patients. But think about it. The patients, everyone that comes in, are they all going to benefit from therapy? No. Or some patients going to be surgical candidates? Yes. Do some patients have major red flags that you need to send them off to someone else? Yeah. Do patients have maybe, pain or issues like that, but maybe it's psychological and they need counseling, they need help? Yeah. Sometimes patients just don't get along with you. Your personalities clash. They were probably going to do better with someone else. Or maybe they're stuck with you and this clash. Maybe some people are just not motivated to do stuff. Any number of things. We're going to have those patients that don't get better. But we know to send them off. But we know, 70% that we get better? So on average, a C that get better? Really? And I would say it would probably get harder the higher up that you get. So I would say the more advanced that you go, you're not going to get those easy patients anymore. I know I'll say this about myself. With all the training and everything I get sent extremely difficult patients. Extremely difficult patients. I know other therapists who get sent some of the hardest patients. People with chronic pain for 20 years going on. People born with congenital disorders, things like that. They're born with those. What are their rates? Yeah, it gets harder. And again, I would say if you're a really good therapist and you're getting really easy things, I'm just getting little sprains and strains, these little easy things. Yeah, you're probably going to get really good results because you're getting really easy things. But as you get better, yeah, you're going to get the harder things. That's not a bad thing that you get those harder patients. It makes you a better therapist overall. But what I am saying, I do believe all of it. If average, it's fine. And there's no problem. There's nothing bad with it. There's nothing bad with it. And that if anyone ever tries to say that you're average, like what? It means I get my patients in, I get them moving, I'm educating them, I'm talking with them, I'm building rapport with them, I'm doing what I can, and that most of them are going to get better. It's actually a high percentage of them are going to get better. They try to make it sound like average, like, was it less than half of your patients are going to get better? No. If you do average, no, a lot of your patients. But you also recognize those who are not going to get better. And I think that is a point that shows that someone's a good therapist as well, to understand this person's not going to get better because they're a surgical candidate. This person needs to go over to this specialist. This person needs counseling. This person needs this person needs that. Again, and I think that makes you a good therapist. So we need to be on that. So let me know your thoughts. Let's talk about this. Let me know what you believe, what you think. Let's talk about that. Let me know down in the comments below. You may not agree with me on it, but please, I want to hear from you. If you like the video, of course, hit that thumbs up, subscribe to the channel, and I'll tell you, take care of yourself, take care of your patients, and I'll see you next time.